We are live.
Good evening, everybody. On behalf of AIOS ARC, I welcome all of you to this PG teaching program. We call it a PG teaching program with a difference because this program basically deals with exploring A to Z of research excellence in ophthalmology, the dialogues and insights. We are very much honored to have with us Dr. Santosh Honowar, who needs no introduction. He's an inspiration for all of us, all the ophthalmologists, both nationally and internationally, and Professor Radhika Tandon, a great academician, a great teacher, a great mentor, and a great clinician. Professor Usha is the chairperson of all these four sessions that we have been running for the last 1 month, every Thursday. She is the head department of retinoblastoma services and oculoplasty at Advanced Eye Center, PGI Chandigarh. And very much happy and honored to have two young moderators, I should say, Dr. Parul Ishpujani, professor from Government Medical College, Chandigarh, and Dr. Shubham. Shubham is also a very upcoming, very brilliant oculoplastic surgeon and also ocular oncology. Then we have another two young panelists, Dr. Lilish Kumar and Dr. Mitika. Both are very active members of YOSI and doing tremendous great work in terms of research and academics. So I request Dr. Shubham to introduce all the faculties and also Dr. Parul and Shubham to moderate the session.
Very good evening. It's an honor and a pleasure to invite and have such great stalwarts in the field of ophthalmology to speak to us today. We have Dr. Santosh Honawar, who needs no introduction, who is a name synonymous with ocular oncology across the globe. Being my mentor, being worked with him for the last 3 years, he truly serves as an inspiration, not only in clinical medicine, but also in research and ophthalmology. Soaring heights each day and managing multiple tasks with two hands, equivalent to having 60 hours a day. Also with us, we have Professor Radhika Tandon, who I shall be introducing shortly after Dr. Honawar concludes his talk. And we have two young dynamic panelists with us. One is Dr. Nilesh Kumar, who happens to be a medical director and consultant at the Phaco-Refractive Retina and Glaucoma Services at the Madhavi Netralaya. He has 102 PubMed indexed publications and 3 book chapters. And I may use my creative liberty to now introduce Mritika Sen, who has a dual fellowship, one with Dr. Honawar at Center for Sight and with Wills Eye Institute under the mentorship of Carol Shields. She is AIOS Times editor, which is all in one Saint Times editor. Thank you for being with us for today's session, and over to Dr. Honawar for tonight's talk.
Thank you, for being very creative as usual. And I'll share my screen. Is it visible?
Not yet.
Not yet.
Yes.
All right. So I'll be speaking on how to write a research paper and also how to select a journal, all in 20 minutes. All right. So the definition of research is systematic investigation, including development, testing, and evaluation designed to develop or contribute to knowledge by dissemination of information. So that is part and parcel of the definition of research. So you're supposed to disseminate whatever you have discovered. And of course, there are ways to disseminate, including lectures that I'm doing now, blogs, non-peer reviewed state or city publications, books. But the gold standard of dissemination of knowledge happens to be peer reviewed publication. There are several reasons why one should publish, but the most important reason would be that it opens many doors. Since it's a PG teaching program, for PGs, it's important to have a good CV to start off, and it will definitely help open many doors. And for seasoned academicians, it gives academic immortality. It gives discoverability, accessibility, and reusability of research. So whenever you write an article, the first step is to look back at your work. What exactly have you done that deserves to be written and published is something that you need to be very clear with. So you look back at your work, perhaps your thesis work, and see, have you done something new and interesting? If you've just done an epidemiological study of diabetic retinopathy in your OPD cases, it may not get published in a peer-reviewed journal. So you have to look at what have you done that is interesting. Have you checked the latest results in the field and have you compared your study to what is available in the literature? Are the methods that you have used robust? Can you have a nice story to tell in terms of your research? Can you make a good story out of it? Is the work directly related to something that is a hot topic that is publishable? And have you provided solutions to any difficult problems, such as a complex surgical solution or a complex medical solution? Then you look at what are the potential readers. If you have written something on, say, cysticercosis, it may not have takers in the West. Perhaps it's a disease related to Asians, some South American countries, and maybe Africa, but may not have any takers or readers in the West. So you have to target your research to a good journal. Then, of course, you decide on the journal, which I'll talk a little later. The most important consideration is, once you're decided on a journal, to look at the journal specific guidelines. Every journal has specific guidelines. One way to go about it is to write a generic article and then modify it to a particular journal, which is absolutely fine. But you want to already know which journal you would like to submit the article to, and tailor your writing or the manuscript to that particular journal. Look at the instructions to authors. There are guidelines to the layout, each section, how long it should be. There are word limits. There are ways to use the nomenclature, spelling in terms of British versus American, abbreviations, reference format, and restriction on number of type of figures and tables, and how statistics has to be documented. These instructions are fairly detailed. This is, for example, instructions to authors for IGO, which is very, very detailed. So you'll take time to read it, but at the end of it, you'll have a fair idea as to how to format a particular manuscript for IGO. It's important because editors hate wasting time on poorly prepared manuscripts, and they consider it a sign of disrespect. Editors do have editorial egos. Now, the second thing that is a very important consideration is that you have to go through this checklist. For this is a standard checklist. This is a set of standard checklist that is available online. And if you have done a randomized clinical trial, then you have to use the consort checklist. If you have done an observational study, then strobe would be applicable. Then if you have a series of case reports, for example, then there is a checklist called CARE. But since we are talking about research articles, I would stick to consort and strobe. These are very important checklists. Once you've gone through this checklist, you exactly know what to write in your materials and methods, what to include in your results, because checklist is so comprehensive that it will prompt you to include certain things which you otherwise may miss. If you're not sure where your article would fit in, and if you're not sure of which checklist to use, simply go to this equator-network.org and fill in the study type or the clinical area, or even just copy and paste your abstract, and it will tell you which checklist to use based on the AI based tool currently, and it will tell you which checklist to use, which checklist will be most appropriate. What is the anatomy of an original article or a research article? These are the components of a research article, out of which the most important component would be introduction, methods, results, and discussion, summed up as IMRAD. And which sequence would you follow? It is okay to follow this particular sequence. You can start with the title and go in the same sequence, but I would recommend that we follow this approach. Methods is easy to write. It is very straightforward. You mention exactly what you have done. Results is also very straightforward. You clearly mention what are the results of the study. Then you go to discussion. Based on the methods and results, you clearly go to discussion and conclusion, and finally come to introduction, last of which would be abstract, and finally the title. This is how I would write, but it is individual. You can start with the title and go forward as well. So how should a good title be? Good title should contain fewest possible words, and yet it should adequately describe the content of the paper. It should arouse interest in the reader. The reader should go ahead and read your abstract and then further get interested in reading the entire manuscript. So you have to be very specific, concise, complete. You can use a tagline, and you can have a provocative question. For example, does multimodal treatment improve, say, life salvage in rhabdomyosarcoma? That's a provocative question. This is by Radhika. She has written this article. Her title is very simple and straightforward: intravitreal topotecan for vitreous seeds in retinoblastoma, a long-term review of 91 eyes. So it says everything. readily see that it's a larger series, it's a long-term review, and the drug used and what specific disease was it used. So this is a very ideal title. Then you go to the structured abstract. This is journal dependent. Some journals just say purpose, methods, results, and conclusion. You have to structure your abstract only on those four categories. But for ophthalmology journal, you have all these measures. This is again from the same article that I was quoting, Topodican article. You have purpose, you have design, you have participants, then you have methods. So otherwise, design, participants, and methods could all be put in methods itself. Even main outcome measures would be part of the methods. Then you go to results and conclusion. So this is a standard structured abstract. You can have a, depending on the journal, you can even have a descriptive abstract, but mainly descriptive abstracts are for review articles and not for original articles. So a good abstract should be precise and honest, should stand alone. Means if somebody reads your abstract, they should know the gist of your article. Without having to read the article completely, they should know exactly what is written in that article. It should be specific. There should be no high technical terms and abbreviation should be minimal. The introduction should be used to provide a context for your manuscript. It should define the problem. It can start with a brief sentence or a couple of sentences on what exactly is the disease that you're dealing with, what is the problem, what problem are you encountering, and what solutions are possibly there, and what is your work trying to achieve. All this should be mentioned. For example, our article on retinoblastoma started with a brief introduction on retinoblastoma, then it went to the enhanced life and eye salvage. Then we talked about the vitreous seeds, how difficult are these to control, and finally the drug that is currently used for vitreous seeds, melphalan, and what complications does it have, so that we are now making a case to find a different drug as an alternative to melphalan. And then we talk about the use of topotecan as an option. So we say finally that we describe the results of the use of intravitreal topotecan against vitreous seeds in eyes with retinoblastoma. So we have gone through the reasoning as to why we wanted to do this study just in the introduction. Method section should be the bulk of the paper, and it must provide sufficient information so that a knowledgeable reader can reproduce the experiment. If somebody wants to, agree or disagree with your manuscript, with his experience or her experience, they should be able to do exactly the same that you have done. So that's how detailed your method should be. It should be reproducible. So components of methods would be you define the population and methods of sampling, describe the instrumentation, describe the procedures if relevant and the time frame, analysis plan, and any approaches to ensure validity and reliability. So in the results, there are certain do's and don'ts. Use figures and tables to summarize data. Don't repeat what you have said in tables in text. Show the results of statistical analysis appropriately. Confirm that the method that is used is reliable. Justify the short choice of methods that you've used and define the limitations of methods. Do not duplicate data, and the graphs are supposed to illustrate rather than just fill in page. So this is how we would present a table. The first table contains all the epidemiological data and subsequent tables talk about results, and pictures should be matching as far as possible. Try to color contrast match, and also the same field that you're showing in pre-treatment should be matched in post-treatment. It's very important, otherwise people will not be able to compare the pictures. And the legend that you're given for the picture should again tell a story. It should be standalone, in the sense that if somebody sees a picture and the legend, they should know exactly what has happened to this patient without having to go into the text of your manuscript. And in the discussion, which is a very important part of the manuscript, you should describe what do your results mean? Was the choice of methods useful and successful? How did the findings relate to those of comparable studies? You can actually include a table. If there are 5, 6 studies which are similar to yours, include a table. And through that, just try to justify as to how your study is relevant. Maybe you have a larger number of patients, maybe you have approached the patients differently, maybe you have a different treatment approach, Maybe your results are better, maybe your complications are fewer or more. So you have to have a table if you have a way to compare the studies that are existing. What is the immediate and remote relevance of your study? Is it clinically applicable immediately, or maybe it will have relevance after a few more follow-up studies are done? And importantly, what are the limitations of your study? Next would be conclusion. Conclusion could be one single sentence, but I would suggest that you have a small paragraph. Basically, you include how does your work advance knowledge, indicate immediate clinical applications of your work, suggest future experiments if you think it's appropriate. Do not hide negative data and do not speculate or extrapolate. Conclusion should not contain anything that is beyond the data or results of your study. So, in ophthalmology, for example, there is no separate section for conclusion. This is the last paragraph of the discussion that where we build in conclusion, and we have put a detailed summary of the study here, and finally say that vitreous seed recurrence after IVT was found to be most common in eyes with spheres, etc. So basically, we have, in summary, talked about the article in the conclusion. So this is acceptable. Then references should follow journal format. Use only the relevant references, be specific, and avoid or minimize self-citations. Self-citations are not to be, flamboyant measures of your own prior success. It's just to build up a story and not really to get you more citations. So from that perspective, you have to minimize self-citations. So for a good article, friends are clarity, conciseness, and correctness. Enemies are repetition, redundancy, ambiguity, and exaggeration. So you should know your friends and enemies. Language is very important. So if your language is not good, some of the articles get rejected only because of poor language, because no editor or sub-editor would have the patience to get the language corrected. So that's a problem. So once you've written, read the article, just wait for a week, let your mind be flushed of all the thoughts about the article, then take it up after a week, read it with a fresh mind, or ask a friend or a colleague to read who does not know much about the topic that you have written, but he or she should be able to understand what you have written. Check compliance to the checklist and compliance to the journal requirements, then you're ready to send. The next step, of course, this is a step that happens before you write the manuscript in certain situations, or it can happen after you've written the manuscript. How to find a good journal. Finding the right match is extremely important. Otherwise, you don't want to be mismatched like this. It may be good in fashion, but not in academic articles. You should not have a mismatch. And there's a jungle out there in ophthalmology. There are 300 plus journals, and finding the right match depends on three main factors: scope, reputation, and turnaround time. So, depending on what type of article is yours, if it's a photo essay or an image, then ophthalmology has pictures and perspectives. Ophthalmology retina has similar. The thing there is even IGO case reports has it. Main journals don't publish case reports and small case series. You should be aware of that. Surgical techniques are published only by very few journals. So you should tailor the journal to the type of the article. Most important is, does the article fit the focus area of the manuscript? If it's purely basic research, clinical journals would definitely don't want to touch it. So you have to be very clear about that. Does the journal regularly publish in good numbers the category of manuscript that you're aiming at? Does it serve the target audience? If you've written something for the knowledge of Indian, say, readers, then no point publishing it in BJO. Better choose an Indian journal. But at the same time, if the scope of your article is absolutely international, then you should go for international journals, or maybe a subspecialty journal. If it's a very focused article on a separate, on a different way of reconstructing an eyelid, a very sophisticated flap perhaps, then you should go for an oculoplasty journal rather than a general ophthalmology journal, for whom it will not be of much use. Reputation depends on many factors. Years in publication, it should be by a reputed professional publisher. The journal should have a reasonable impact factor. It should be PubMed indexed, otherwise your research will be sequestrated. It's not possible for anybody to pull up your work. It ideally should be an official publication of a reputed professional society, IGO for AIOS, ophthalmology for American Academy of Ophthalmology, and so on and so forth. Your peers should be aware of the journals and regularly should be able to access it. Now, if you don't know about a journal, just go to this NLM catalog, National Library of Medicine catalog, type in the name of the journal, and you'll get its history. So you'll get everything about the journal with this NLM library, and it will tell you whether it is indexed or not, and what is the source of indexation, when did it start publishing. So you know the history of the journal. Impact factor is a way to calculate the impact of a particular journal. That is one way of looking at it. The other way of looking at it is go through site score. Site score is easily accessible on the Scopus website. So if something has a journal has a site score is from IGO, is about 2 plus, then it is a reasonable journal to publish with. Other impact factors are Eigen factor score, alternative matrices, and there are many other rankings such as SJR, SNP, GIF, and H-index. You can go through that if you're very, very particular about that. Then open access publications, you should be very concerned that your article should be published in an open access publication, because then the accessibility of your article and therefore citations will be higher. Any journal which is open access can also charge an author fee. You should be aware of it. Otherwise, finally, after it is accepted, you might get a bill of $2,000, which you may not be able to pay. Predators, you should be very aware of these emails that you get once in a while asking you or requesting you to submit an article for a journal for an expedited publishing and etc. So these are predatory journals. They are from unknown editors, unknown publishers. They solicit publications. They have a hefty publication fee. They don't have or have a lightning peer review, not indexed. They're not on directory of open access journals. So if something is not on DOAJ, you should be aware of it. And if you still don't know whether it's a predatory journal or not, go through this BIALS list or predatoryjournals.org. That's a list. Turnaround time, 6 weeks to 3 months is absolutely fine for peer review. Initial technical check should be completed in a week. Pre-review 3 to 4 weeks. Acceptance to proofs about 4 to 6 weeks. Acceptance of publication 3 to 4 months. If a journal takes anything beyond this, then your work is getting obviously dated. So you should be aware of journals which take a long time. Journals have a rigorous selection process, and very important that a particular journal that you're submitting has a very rigorous peer review process, layered peer review process. How does it help? Sometimes you can get really bashed up, but it will help you polish the article to the extent that it is acceptable in the next journal that you publish. So this is how peer review helps polish up articles really beautifully well and make it presentable to the next journal that you have in mind. So checklist, I won't go through wasting time. So if you still have any difficulty in finding the right journal for your research, you have this journal finder by Elsevier. Simply type in your abstract or search some keywords that you have in your article, and it will help find the journal for you. This is also an AI-based tool. So that's about it. Thank you so much.
Thank you, Dr. Santo. Excellent presentation. I'm sure everyone must have really learned so much from your talk. Any questions from any of the panelists or moderators? If not, I have a question. Yeah. How do you respond to the peer reviewers' comments very constructively?
Yeah, so you should never be rude. Even if you are absolutely right and the reviewer is absolutely wrong, you should still thank them for constructive criticism. Yeah, and then explain each of your points in a tabular column. You should actually have 3 columns. The first one, mention their comments, and the second one is your response. And in the third column, you mention exactly where in the manuscript, which page, which paragraph is your correction, if at all you have corrected. And in the same column, you can also mention if you have not done any correction, justification for not doing a correction. You can give a reference, perhaps a published source or something else, which is a evidence that they can refer to as to why you have not made that correction. So if you do that and write a cover letter to the editor, not to the reviewer, saying that, well, thank you for all the suggestions and you have addressed all these suggestions appropriately, please reconsider. That's where it ends. Don't show your anger.
Mritika, would you like to add something to your mentors?
Yeah.
Yeah.
Thank you, sir, for a wonderful presentation. I mean, there's still so much to learn. I just have a couple of questions. One is that many a times most of the research starts with creating an Excel sheet, and then you start entering the data. In a lot of retrospective study that we undertake, a lot of times the uniformity is not there when you start collecting the data.
Correct.
So what you initially think would be a really large sample size sometimes gets narrowed down depending on the follow-up period or the information that is actually available. So that is, of course, one of the limitations whenever we start off a study on a retrospective basis. Uh, how would you like suggest that initially do we start just collecting all the data, or do we have something in mind, that what we are looking at before we start, or just collect first and then take out multiple projects from it, or try to put all information together in one?
Everything that you said is possible. If you are the primary clinician who has done that work, no, suppose you have a cohort of, say, ocular surface squamous neoplasia. I know that I have done that work. These are all my patients, so I know how it has worked, a particular treatment modality has worked. So I may want to look at it, but I'm already, I understand that every data may not be complete. So whatever that is, in some of the files, the size of the tumor may not be mentioned, but you have the pictures, right? You know the corneal diameter, you have the pictures. You can always use image and measure the size of the tumor and put it in your Excel sheet. So these are possible. These are problems with a retrospective study, but these are not unsurmountable problems. If a patient doesn't have a follow-up, all you need to do is call and record that call or log that call in so that you have a documented evidence that you called the patient and the patient tells you that I have seen a local doctor and I'm doing fine. I don't have any recurrence. That's good enough for us to say patient to send a picture. That completes your follow-up. So you can do many of these. But yeah, it's a good idea to already know, for a for a good clinician already knows what are the variables that he or she would like to put in a manuscript. So when you document these patients, whether on paper records or EMR, you always make these points on paper, right? As a matter of fact, I'm pull up so many fellows for not making that tick somewhere, not mentioning vascularity, not mentioning feeder vessels, because those are the points that you ultimately want to use. Like in retinoblastoma, it's very important to document subretinal seeds present, not present, the location of SRF, everything is important, right? Diagnosis and treatment are fine, but the finer details that you pick up during your evaluation should all be documented. Otherwise, retrospective studies become redundant. So that way, EMR is good because it compels you to fill in certain fields, which paper records don't.
Would you put your data, like if you have a lot of data in one paper, or would you like to divide it into multiple papers or put in supplementary
Yeah,
materials?
so you don't want to salami slice. At the
Mhm.
same time, if your data is large, and if you think you can make 2 or 3 meaningful manuscripts out of it with different outcome measures, I think you should do it. Like example, again, ocular surface squamous neoplasia, if you have a cohort and if you find that there are a lot of HIV positive patients, then you can make, have a sub-analysis on ocular surface squamous neoplasia and HIV seropositive patients or xeroderma pigmentosum for that matter, or patients who have undergone plaque brachytherapy. So everything is possible if you have hundreds of patients, right? So yeah.
I have a question, sir. Always a delight to listen to you. There is such an upsurge of the open access journals, and once somebody is charging you $2,000 or 2,500 euros, they become a little bit more liberal in accepting. So, do you think that is going to dilute the quality of publications that are coming out of open access journals, which are charging quite a significant
Yeah,
APC?
that's already diluted to a great extent. I think their peer review is not so rigorous, but they have a good impact factor. So just because they are open access, it doesn't mean that you should not publish in them. If you have research funding, project funding, or institutional funding, or if you can afford those $1,500, you know, you can publish in open access journals. There's no harm. But at the same time, it should be a reputed open access journal. It should be part of directory of open access journals. It should have an impact factor, respectable impact factor. Then you can publish it.
Thank you.
So I had one question, sir. Actually, it is about my thesis only. I did my thesis on coronary topography and evaluated the postal surface using orb scan. Now there are multiple studies that are saying that orb scan also can be used for posterior curvature evaluation, but most of the journals rejected my thesis, saying that the pentacam is the gold standard and you can't. But the entire follow-up was there was pre-op and post-op, and I was not telling that it is comparable or something. It is just like that this can also be used for evaluation. So how to now go about it? I that thesis is written now. It has been 4 years, but I think going forward it can help others, those who
Yeah.
don't have standard these gold standard instruments.
Yeah. So you have to find a journal that buys your argument. No, rejections are a norm in academic publications. No journal would have an acceptance rate better than 20% or 30%. So you have to keep on moving ahead, and then, you know, finally you'll find your fit. But you should not wait on it. If you get a rejection, maybe in the same week or the same month, you should send it away to the next journal.
Next,
The very reputed authors who I've heard from Dr. Biswas and Namrata Sharma that their highest number of rejections was in 2 digits. So it's possible sometimes to have so many rejections, but if you persist, definitely you'll be able to publish it in some, if as long as you believe that your work is decent and you have something to tell.
so it doesn't mean that you have to have the best of the equipments for any follow-up or anything.
No, if see, so for example, if something is a gold standard and it's a known gold standard, if
Hmm.
you're once it is established as a gold standard. Now, for example, if we all know that applanation tonometry is the gold standard for intraocular pressure measurement. Now, if I evaluate Shear's tonometry on top of it, then I won't have a case to submit an article in a
Hmm.
good journal, isn't it? Unless you say it is useful in this particular set of patients. But then there may be other instruments which are better than Shiots, right? So that way it has a disadvantage. You
Hmm.
already have a gold standard, and then mm, we are showing something else as equally good. That makes a little problem, I suppose.
Dr.
Thank you,
Usha,
sir.
Dr. Usha, would you like to add anything or ask any question?
Yeah, I think I've heard Santosh earlier also. He has covered up all the aspects beautifully. And yeah, some relevant questions like parole and open access journals. Um, I think we have to look into their history of those open access. They are definitely diluted, their standards are diluted. And sometimes you do get all these calls on the mails, that please write an article. You just have to look up on the Google about that journal and everything. So they'll ask you to write some chapters or some, something on some specific. Sometimes they are not even relevant to your specialty. Sometimes you'll be asked to write something which is not even your specialty.
Mm.
So you could just reply to them. That's the most of it is covered beautifully and it's very clear. Thank you, Dr. Santosh.
Thank you. Okay.
Thank you so much.
Dr. Shubham. So with this, we go to the next speaker. Please introduce Professor Radhika Tandon. Thank you, Dr. Santosh, very much.
It is with immense pleasure that I have this opportunity to introduce Professor Dr. Radhika Tandon for tonight. She is a professor of ophthalmology and chief at the RP Center, AIMS, New Delhi. She heads the cornea refractive services and the lens services and is the past president of the Eye Bank Association of India. She has a list of academic achievements, and I shall go through the list very slowly. President of India Silver Medal in 1985, the RCS Edinburgh Gold Medal in 93, the IIRSI Gold Medal in 2008, the American Academy Achievement Award in 2011, National Academy of Medical Sciences India Fellowship in 21, National Academy of Sciences India Fellowship in 22, the ISCKRS Excellence Award in 22, named orations such as the P.K. Jain Oration, Dr. R.P. Danda Award in 24, Dr. S.N. Mittal Oration in 2024, G. Mukherjee's Oration in 24, and late Dr. Nilima Pawade Lifetime Achievement Award by the Vidarbha Ophthalmic Society in 24, Appreciation Award and the Gold Medal by the Bombay Ophthalmic Association in 24, member in the clinical advisory board by the Akhand Jyoti Eye Hospital for 3 years, contributing towards the achievement of Vision 2030 goals. Honorary advisor in ophthalmology for implementing the NPCB and the visual impairment in the Ministry of Health and Family Welfare in 25, and awarded the HOS icon by the Haryana Ophthalmic Society 25. To her credit, she has authored more than 300 peer-reviewed publications and number of book chapters with a H index of 46 and 8,522, staggering number of citations. Her special interests include corneal transplants, keratoprosthesis, eye banking, stem cell therapy, and in the refractive segment, the femtosecond laser, the ICL, the premium and the toric IOL, cataract, and pediatric lens surgery. Over to Professor Dr. Radhika Tandon for tonight's talk.
Such an impressive CV.
Thank you so much for the kind words, and thank you for inviting me and giving me the opportunity to participate in this really nice and useful session. I'm just going to share my screen. 1 second. One second, I'm having a little challenge. As I told you, my computer had crashed. So when I was trying with my laptop, it was not allowing the Google Chrome to access. So I have had to shift to a desktop, which I don't normally use for this. Just give me 1 second, please.
Sure.
So you're on Windows or Mac?
Now I'm on Windows. I'm on Windows. And I can see my presentation
Ma'am,
here.
can you email it to me? I can take it from my system.
Okay. I have
You can
sent
put it in
it.
chat here also, Doctor.
I've sent it. You're saying I can load it in the chat?
Yeah, but it's not there in the system. It has not come to my emails.
It's not come yet?
We've sent to kasturbathachaji44@hotmail.com, right?
Yeah, I sent it. Yes. The one from where you sent me the link. Should I try again? Share screen.
Yeah.
So I've got Microsoft Edge tab showing, and then I've got the window.
Doctor, have you joined through browser? I think you joined through browser.
Yes, yes.
You have
I
to-
joined through the link.
Yes, but you joined through browser. Can you just log off and join through application this time?
What do I join through?
When you click on the link, just enable a launch application. Don't join with browser.
Okay, got it. So I do launch meeting.
G.
But it's not come to my inbox.
Doctor, entire mailbox is visible. Can you just stop share?
Yeah, I got it. I got it.
Have you got it or not?
Yeah, I'm going to. Yeah. Can you see my?
Yes. I'm really sorry about that. Okay, so then you'll advance the slides for me. Am I audible?
Yes.
Okay. So, firstly, I think it's really progressive of this ARC, AIOS, ARC to have included this topic in a PG teaching program. Some of the PGs may think that why should we listen to this talk or what is the relevance to us? So I'd like to say for those who have that concept that some of the things which I mentioned are universally applicable for any kind of proposal, research, thesis, your MD thesis writing, and even for that matter, if you're later going to publish your paper. So that's one point of view, that whatever I say will be a support of what Santosh has already said, and from a little different perspective. But the other thing is that people who are doing PG will eventually be, graduating, and they will be coming to many situations where they will be having to write proposals. It may not necessarily be a research proposal. It may be a proposal for funding for their clinic, or it may be for funding for, say, anything that they're planning in terms of a new technology or a new service and so on. So a lot of these things that I'm going to talk about are quite generic. But coming back to the main topic about research proposal writing, why grants matter is a little thing that you need to think about. Now, here again, what is a research grant? It is just a support for the research work you do. So you may not apply formally to a funding agency, but you may make arrangements to have some amount of funding to do your work. It may even be in terms of finding somebody to help you with maintaining your Excel sheet, or even helping you with the questionnaire. So you may not be getting money per se as your grant, but you may be enlisting somebody or a person who is going to help you with your research work. So, in a way, the research that we do, it may be part of your thesis or later on. It's, you have to realize, you have to feel passionate about it. That if we just stop doing it, then they're never going to have scientific progress or innovation. So you need to inculcate this concept. Everything you do every day, just see that is there something that I've seen with my experience that is worth studying further. Like can we dissect this out further, or get some new information from this experience? You may be even innovating a new instrument so that you can further the quality of patient care, teaching, and research in ophthalmology. And consonant with that is, of course, that is going to help build your academic career, and is going to provide funding for staff, equipment, and travel, because that will give you an opportunity to share your experience in a conference. You'll get the support to do that. And it also enhances the institutional reputation. So these are the traditional benefits of writing for research grants. Now, what are the types of research funding? As I already gave you a very informal type of research funding, which I mentioned, that it is a kind of a unwritten informal way that you are arranging some kind of facilities or logistic support for doing the research, because you may not be able to do everything yourself. But when you're going for a formal research proposal, then you may need to be aware of what are the various sources that you can tap. There are, of course, the government grants in India. There are also private foundations across the world, and these are some of the more reputed and the more prestigious and sought after, the Wellcome Trust and the Gates Foundation. Then there could also be institutional or intramural. A lot of the universities or colleges do give a little seed funding. They give a little that you can maybe buy a few consumables, buy something, or the courier, or whatever you may be requiring for your questionnaires or your research project. And then there are also several international places that you can apply to. And similarly, there can be industry sponsored research funding as well. You may have an idea of innovative design, some instrument, or some pharma company may be coming up with a new drug or a new device. So that's how you find out and where to find grants. And that has two-way importance. One is that a lot of the governments now do have a central repository of ongoing grants, so that you know that this is what's already happening. So even in India, we have a ICMR maintained database of the clinical trials gov. And plus, similarly, you have grant databases where you know that what are the grants which are already funded, and where, what are the topics and so on. Similarly, university research offices, society bulletins, mailing lists, and newsletters, you will often get a call for proposals. And with the modern day technology, often there will be an ongoing website where you can periodically check if you're a very passionate researcher, it's something that is a part of your daily work or your DNA. Then you would be just regularly checking the DBT or ICMR websites to see when are they giving the call of proposals. And this call for proposals may be of two kinds. One is it could be an ongoing that you can apply anytime, it could be rolling. The other is they can sometimes be asking for proposals in specific areas. For example, they may say oncology and so on. So you have to keep looking and then finding a suitable grant. So you have to match the right grant to your idea. So what is your mission? And what is the funder's mission? You have to try to match the two. Now, sometimes there could be invitation for research on environment, or it could be on, say, oncology. So that does not mean that an ophthalmologist cannot apply. So you see if you have a particular project that is aligned with that. And then always check the eligibility criteria. Some of them are for young researchers. So then you have a better chance. And sometimes it may want a particular, it may be multi-centered and so on. So read the eligibility criteria carefully. Look at the size and the duration, and then look at the deadlines and if there's any concept of resubmission required. So check all these policies, particularly the deadlines, and never leave it till the end. It's happened often that if there's a deadline, say 5 p.m. on a particular day, and as you near that 5 p.m., often there will be a crash of that system because so many people are trying to upload. And sometimes the websites are not that efficient. It's a little time consuming process. So be ready with whatever you have to upload and try not to leave it to the last day. Next, please. Now, here, this is what I meant when I said that the things that I'm going to mention are quite universal. So they're the core elements of a proposal, and they largely reflect the core elements of any research project, thesis, paper, and so on. So there will be a title and then there will be an abstract or a summary. What will vary is there may be some variation in the structure of the abstract. Like in a research purpose, it will be your background or the introduction, then your method, results, and conclusion. So here, obviously, this is the proposal. So you will not have a section on results and conclusion, but you will have a little bit more of the background. And in this summary, you must highlight, don't make it very boring and write everything. Important thing is to give the key thing as to what is the background, what is the basic premise for which you are going to work, and what is the information which is lacking, which your work is going to fill that gap, and how do you propose to do it. So this is the background, the significance, and then state the aims and the objectives and what is the proposed method design, and also put a timeline. So what would you do in the first 3 months, and what do you expect to, what is the milestone that you would get by the 6 months, 1 year, and so on. And then add your budget and justification. Justification, we will include the manpower for manpower resources. Otherwise, it may be consumables, there may be contingencies, there may be travel, and then there would be sometimes even publication charges are provided for. So read again what is the grant format, and then fill in all the information, and then of course the references and the CV and the bio sketch. Here also sometimes various sites have their own specific individual design of what they want. Some of them want you to start from current backwards, other ones may want, right from the origin of when you started your work, and so on. So the other thing is that again, the basic concept of your research questions. When you're looking, you may have an idea that yes, I want to work in this area, but then try to think about that research question and split it into a way that a nebulous idea or a broad idea is again being specified in a very scientific and a logical way. So look for things which could be specific. Then within that area, see what are the measurables that can be put. Sometimes it could be subjective, it could just be patient satisfaction. But even for patient satisfaction, you need to have some value so that you can measure and analyze it. So then you may have to use a satisfaction questionnaire. If one doesn't exist, you may have to create it, and so on. The other thing is, see if it's achievable. So supposing if you're applying for a short-term grant, similarly for a thesis, if you're going to actually do your thesis data collection over the period of 1.5 years, then be very careful if you put a very long follow-up of 1 year. Because you may not be able to achieve that. So sometimes put a more achievable goal like 6 months, and then you can say 1 year preferable. So that means it's understood that each and every patient, you may not have that 1 year outcome. It should of course be relevant. So whatever you just think about it. Now these words may just sound like they're all similar, but what it means when you're relevant is, again, see that what you are measuring, is it going to be clinically relevant, and then also it should be time bound because you have to finish in a finite point of time. So here, for example, I'm giving you one case of, say, you'd want to compare the 12-month graft survival in penetrating keratoplasty versus deep anterior lamellar keratoplasty for viral keratitis. The moment we're talking about a 12-month graft survival, so it automatically means that minimum 1 year follow-up is going to be required. So then in your timeline, you'll have to include another 6 months after that for the analysis. And then here you'll see it does say graft survival. So in your primary outcome measure, you would say that the graft remains clear, but you can also put secondary objectives. That is, you look at the apart from the actual graft survival, because what's the relevance of just graft survival? Simple graft survival is important, but it may not be as relevant as to say no, as to know what is the visual outcome, patient satisfaction, or even the rate of complications. So these other things you may then put in your secondary objectives, or in your as your secondary objectives, basically. So when you're writing it, you should use the activa that this will be done, rather than this is done. So it'll be this will be done, and the project will include patients with viral keratitis who have been confirmed to have things like that. Then avoid using. It is a habit that one uses short forms, and one's so used to SMS and other slang words that one should avoid, and be particular about the grammar and syntax. And here again, a lot of people confuse between hypothesis, aims and objectives, etc. So broadly speaking, they all are meaning the same thing in terms of what you're going to study, but they always tell you the breakup in a specific way. So the hypothesis may be that the 12-month survival will be better with DALC compared to PK. And how will you show that? So you will have these two groups, and then you will compare. So that is how it is. So that aim and objective is So the hypothesis is that DALC will be better than PK. Then you have to write your aim and objective. The aim is to study the 12-month graph survival of DALC versus PK and viral keratitis. And then you specify the objectives. The primary objective will be the graph clarity as a graph survival. Secondary objective will be the vision and the lack of complications or infectious episodes, and so on. And then if you put any figures and tables, they should also be labeled, because you may want to describe something in your review of literature or in your Gantt chart. So that should be self-explanatory. You should not have to search in the text or the paragraph to know what this is going to be, and then revise. And you can even get feedback from colleagues or the co-investigators. And when you're including co-investigators, and for students, if they're having their co-guides, share it with them a little in advance. I know they all try to get it perfect, and they want to get it perfect and then they want to share it, but then it becomes too late. It becomes too near the end point or the deadline. So you can always share it earlier and say, this is pre-final and I shall be grateful for your feedback, and these are the slides I'm still working on, or these are the sections I'm still working on, but meanwhile do have a look and give me your suggestions. Now, similarly, budget and justification, this sometimes people find difficult. There are guidelines our website and DT website and all. They have this data entry operator. You may want a field worker, but you cannot just use any term that you want, because you're applying to a very formal government grant system. On the other hand, maybe Wellcome Trust or the others may have more flexibility. So see as to what is the structure of the granting agency, and then fine tune it to that. So personnel, you will have to specify what person you want. Then you have to specify what will be the qualifications for that post. And then based on the guidelines, what is going to be the salary. And you'll have to calculate that for the duration of your proposal, supposing it's a 1 year, 2 year, or a 3 year grant. So you'll calculate what is going to be the cost for the salary of that person per year, and then overall you'll have to add it in the grand total. Similarly, with equipment, consumables, travel, and overhead, some people wonder what is overhead charges. This is because many academic institutions, they are providing the infrastructure for the work. So they're providing the basic normal water, electricity, the physical space, and the other ancillary logistic support. So they charge an overhead of say 3%, 5%, 10%, or 15% of the overall grant as their compensation for the expenses that they incur in giving you the research facilities. So you have to check what it is, and then you have to add that to your actual cost to give you the total amount that you're going to ask for. And you need to be realistic, because if you're asking for something which is unreasonable, then it's not going to be accepted. So avoid any under or overestimation as far as possible. Next, please. Then before you submit, again, check the formatting, because this sometimes in the hurry, one is so focusing on the research part or the scientific part that one sometimes ignores these other things. So check the formatting, try to keep the font size of the normal text about 12, and then you're 11 or 12, and the headings can be kept about 14 or 16. Try not to go below 12 because it becomes too small, and then just check that the headings are properly numbered, and then the pages are numbered. You can even add a header. And then you have a procedure for institutional approval. So you'll have to go through your guide or your head of department, and then the institutional, the principal of your college or the director of your institute, and so on. And again, you'll find that you may have put everything together in your laptop or your desktop, but when you have to upload, these things have to be submitted separately. So then you'll have to make separate files, or separate it so that you can upload each part separately. For example, they may want the summary to be separate. They may want the budget to be each uploaded individually, like the manpower separately and the consumables separately, and so on. And allow buffer for technical issues. I meant that don't leave the deadline right to the very end. Give yourself adequate time. Then, understanding the review process. So these grant applications do go for peer review. So here again, For you, it is what you understand, you know, and for you, you're so busy writing it that you're familiar with it. But take a step back and see that this document is going to somebody who's going to have to look at it independently. So that person shouldn't have to search back and forth to look for the information. So make sure that it is very clear and self-explanatory. And then usually these are the usual parameters on which they compare, because nowadays everything is competition and it's selection and elimination. So therefore they will look at the scientific significance, they'll look at the innovation, and they'll also look at the approach. Like, is the study design that you've created appropriate for what you want to prove? So they will see, is it doable? They may even see whether you have the facilities or whether you have the clinical expertise. Then they will also see, is it clinically important? And is the team capable? That they will see, because all the co-investigators will be having their CV and their past record, and that will be taken into account. As you understand, there's a shortage of resources and there is always going to be competition. So sometimes it may get rejected. Simply may also be that it may not be a priority area. It may be a very good idea, but the funding agencies also, they tend to have their priorities. For example, they may go a lot for cancer research or non-communicable diseases, and sometimes you find that your idea may still be very good, but it may not be matching the organization's perspective as to how they want to focus on their grant funding process. Sometimes they may send you back, they may give you feedback and ask for some questions or their clarifications. So read that and address all that very clearly and take it very seriously, because the very fact that they have asked you for clarification means that yes, they're interested, but weaknesses, and obviously some peer review person or were fallacious or missing or weak in your proposal. So try to address that adequately, and again try to make it easy. Then don't make them have to search back. So write the question or whatever comment they had, give your answer, and then you can also give a reference to support it this way or that way, revise and resubmit. And if it doesn't work with one, you can consider other funders if needed. Next, please. So I would say start early. So even under PG, a lot of the colleges are now trying to give funding for PG thesis, and ICMR also does that to try to start early. Know your funder, keep it clear and focused, and have a backup plan. Because if particularly if it's a thesis and you're depending on the funding, firstly allow that there may be a lot of delay. So you must have a backup plan. You must have a thesis topic which is flexible and you can manage without the funding. So don't make it too rigid that you have to depend on funding, and build a team and persistence pays. Thank you. So workshops and webinars like this are what's very good. Sometimes there are online courses also, and institutional support officers can help you with that. So those are things that you can pick on. And of course, you will have faculty who have experience with this, and they will be able to guide you as well. So I'll stop here. Thank you.
Thank you very much, Dr. Radhika. So wait, let me stop sharing. So Dr. Parul, would you like to initiate the questions?
For a junior resident, usually their world revolves around their thesis. So, do you really think that it can be given as a suggestion right in the beginning when they are when they're having their thesis protocol writing workshops, to take their baby steps into the world of research writing or the grant writing? So probably that can be inculcated right in the beginning of their post graduation, that they can inculcate further. So, ma'am, what are your thoughts about that?
I think that's good because that's the beginning of their journey, and some of them are very, they get the concept of the thesis straight away, and they really get motivated, and they do the review of literature, and you give them the idea, and they search for it themselves, and they come up with their own concepts. Some of them struggle, but I feel it's always good to do hand holding right in the beginning. And even if the ones who are struggling, again, don't spoon feed them, because in a way you're doing them a disservice. So be supportive, and just like you said, encourage them to get into the baby steps of going for research funding. So I would say that all the academic institutions should have a small money amount of money that they can give to support the thesis work. Even the very concept that, how you learn how to organize yourself, and I'm going to have to photocopy the questionnaires, it's going to cost me this much, this is going to be the printing cost. It may be a very small amount, but as you said, just the thought process and being more organized and working systematically. And then, of course, it even the process of going through it helps them to be more engaged with their thesis work also, because that right in the beginning they understand that this is something which can be done in future as well. So I agree with you that this has not been the trend to explain about grant writing, but I think a little bit on that explained right in the beginning is a very good idea, and we should do
ICMR
it.
is also having those ICMR STS projects for even the undergraduates to start building up their profile. So that way, ICMR is contributing quite a bit to this field.
Absolutely, those ICMR projects are really useful because that can, give them an opportunity to apply, and then they can have the support for these projects. Yes.
Thank you for your wonderful talk, ma'am.
Thank you.
Thank you, ma'am, for such a wonderful talk. I think it was such an important topic, and that's not really discussed as often, but I think it was very useful and helpful for most of the PGs. Ma'am, I would just like to ask that, as ma'am said, for postgraduates who are just starting off with their thesis work, a lot of it gets covered when, I mean, a part of the research grant that they'll be writing is also covered in the form of the protocol that they make for their thesis before they submit for an institutional approval, ethics approval, and all. So a part of it is covered there. But even so, I mean, for young students who are just starting their first project, among all these institutes or these organizations which provide these research grants, which are the relatively simpler ones that they can start with?
Yeah. So basically, the whole gamut of them is more for the journey ahead. And I would say that the ones you should start with is your own institute, if there is any provision, and otherwise ICMR. Otherwise, the other ones are not for students at all. Their eligibility criteria only will be that you have to be a researcher with minimum so many years of experience. So it would be the ICMR student grants as well as the institutions. Some institutions have it, and so those are the ones. And I think maybe some associations itself also sometimes they may advertise that, there could be some sort of NGOs, etc. They sometimes give grants, but that's the thing. It's like searching. You don't have that much time to keep searching. So I would say the ICMR STS is the easiest to consider.
Thank you, ma'am.
If someone deviates from the research proposal or from the budget, so what are the consequences?
So obviously you'll deviate for a particular reason. So firstly, if you find that you're having to deviate, it's important to straight away inform the funding agency. There are certain things for which there is they're very strict that if, for example, you have some money under the manpower head, and you're not allowed to use that then for consumables. So they usually made it quite rigid now. The manpower head or the human resource salary head, then you have the consumables, and then you have contingency. So, in case if for some reason it happens often that you may have employed somebody, that person leaves. So, you have a few months of salary which has not been paid, so you have that money. And on the other hand, you may have realized that your consumables are going to be more. So, you could write a justification and take permission from the funding agency before the end of your sanction period that this is what's happened. So give us permission. It's called reappropriation of funds from one head to another head. And the other important thing to inform is to take permission to use the unspent balance, because it may happen that by the time the funding agency has cleared your report and has sanctioned the release of the next year's grant, there may be a gap of 2-3 months. And if they don't allow you to use the unspent balance, then if you have staff, then there's a gap when they may not get their salary. So before the end of your that 1 year sanctioned amount, say it's finishing in December. So in October only, you should have a rough idea about how you're going to spend the money in the next 2 months, and say that this head is unspent. So please allow us to carry it over to the next year. And you may be having to say November, December, maybe you're planning to, you put some order for some equipment which is going to come and then you're going to pay. So you can say this is the committed expenditure. So this is the equipment amount. I've used ABC, and the rest of the funds is now committed, which is going to be spent in November, December. So the predicted or the estimated final status is like this. So give me permission for this. So you have to always inform the funding agency. But usually they take a very grim view if you have what you use a word like misuse the budget or deviated. Sorry, you have deviated from the budget. They usually are a bit sticky about that. So it's better to follow that, or you take permission from them beforehand.
One more very simple question. Supposing when we apply for the grant and we have a head, like to start the research, we need a printer, we need a computer, and this research is for 3 years. So at the end of the research, what we do with the computers and on the printer, that should we send it back, or what is the system?
Good question. And one more thing I should have added before, it will depend upon who is your funding agency. This is the Indian government funding agencies who have a little bit more restriction, because you have to follow what is called as GFR, the General Financial Rule. The pharma companies or the other international agencies have a little bit more flexibility in terms of salaries. Like, for example, the Indian government ones will be a fixed salary. For this particular post, it will only be this. So that kind of deviation from the budget you have to definitely avoid. Like, supposing they say the salary is 20,000 for data entry operator, you can't on your own give more than that. You have to give that amount. Now, coming to the thing about the equipment. So at the end, you are supposed to give a list of the equipment that was purchased and what is its status. Is it still functioning or not? And then usually you will say that it is incorporated into, you don't have to return it to the funding agency, but you will say that now it is being commissioned for clinical use or use in the department and handed over officially to the hospital stores. And you'll have to hand it over to the hospital stores. They're not supposed to take it for your personal use. And if something is not functioning, then you can say it's not functioning and has been condemned, but they may ask to see the certificate confirming that.
Dr. Usha, would you like to add anything?
That's how we also do in our institute regarding the leftover equipment. And regarding the funding, you have to also see at what stage of your career you are, whether that amount of funding will be released to you or they would prefer to give it to some younger faculty. So you have to see whether you will, what are the chances of you getting, what are the rules. I mean, for example, professors will not be given some certain amount of projects, or money will not be, some amount of money is reserved only for young under 40, or for these people. So those sometimes the rules come out very late, but you just wonder why you didn't get, despite everything being okay and there was nothing wrong with it. For example, I think a long time back I had applied for some nanoparticle delivery of drugs into the eye for the retinal plasma patient. So the only reason was one reason was that it was a very small sample size, And though it was an important thing from our point of view, but we didn't get it. So there are so many different things which come into, causes of failure uh, to get the grant. So you have to really go into what are the possibility of getting a grant. So those are the things. Just
Yeah.
Dr. Nilesh, would you like to ask ma'am anything?
Yeah, actually, this is also very new to me. I tried to apply for ICMR, but the process itself was so complicated that I left in midway because my institution, nobody had actually applied for ICMR. But this is a new learning for me as well. And most of the questions, I think the question that I had in my mind, Dr. Parul asked first. So I think nothing more to add in that.
Okay.
Okay, so I think with this, we'll end today's program. And any more questions from any one of you? Yeah. Okay, so thank you everyone for joining us today and for all these 4 Thursdays that we are having. A very enriching session, I should say, on research excellence in ophthalmology, and it has been a great privilege to listen to such insightful talks and discussions by all the experts in research excellence. And I hope that this research session has really sparked curiosity among the young generation and has strengthened their confidence in approaching research in a more systematic and a more purposeful way. So, on behalf of AIOS ARC, a heartfelt thanks to all the esteemed faculty, the chairperson, the moderators, the panelists, and every participants for the valuable time and also active engagement. So, with this, thank you all very much. And I think we should conclude. And I should really thank Dr. Parul, Dr. Usha, and especially Dr. Shubha for being with us on all the 4 Thursdays, moderating and chairing, and also to all the esteemed speakers and to the young panelists. Thank you very much.
yeah, it's been a great learning lessons for even for us. So thank you, Kasturi, for this topic, and I'm sure it has benefited many people. Thank you.
Thank you. Good night.
Thank you so much, ma'am. Thank you.
Bye-bye.
Good night. Good night, everyone. Thank you.
Thank you. One more meeting to join. So I'm leaving.